Hi there, my name is Rebecca Williamson. I'm the publisher of Fierce Pharma, and I'm here today with Christine Lee, Head of Health Strategy Partnerships at AnalyticsIQ. Christine, thank you so much for joining me today.
Pleasure to be here.
So Christine, given the evolution of pharma marketing in recent years, tell me, what do you see as the biggest shift in pharma marketing, in the pharma marketing landscape, or the most disruptive influence?
Yeah, certainly there are a number of key contributors to what we've seen in the evolution that's happening in pharma marketing. One that I would say really stands out to me is the mindset shift from promotion to partnership. So patients are certainly more empowered, right? We're people. And so with smarter data and connected experiences all around us, that really puts the patient in the driver's seat, like right there in the driver's seat. So pharma marketers have to really create trust and deliver on value, both to the patient and the provider as a person. And so they have to do all of this while maintaining compliance every step of the way. And so I think that combination is really core and foundational, but I do anticipate that will remain front and center and still part of the continued evolution.
Now, there's been a growing interest in people-based data like that used in the consumer world. How does that translate into value for HCP marketing?
So great question. And you're right. There has been a growing push to leverage more people-based strategies in HCP engagement. And so where people-based data is introducing more consumer-grade like marketing intelligence into the HCP world, this is helping to bridge the gap between clinical relevance and then behavioral intelligence. I always like to say, and at my organization, we are big believers that providers are people too. So when we think about HCP marketing, and when you have a lot of data that's foundational, like being able to understand specialty and treatment profiles, say targeting oncologists treating breast cancer patients, that data is your first step. You have to know that you're talking to the right HCPs. But then when you can take that data further and you can understand more about the individuals that you're engaging with, those providers, those HCPs as people, I think this is where you have an opportunity to really take that personalization and tailor that messaging a big step further. So, for example, when we think of things like, if you could understand more about the decision-making style of a provider or certain preferences and behaviors that go outside of a clinical setting, or even something like language. Now you can look at providers, the providers you need to be talking to, and understand how differently could you engage with, say, your tech-forward, more innovative in nature providers versus those who maybe are more conscientious and conservative in their decision-making style, or other areas where those decision-making moments throughout their day are happening and kind of converging with their day-to-day lives, right? Those blue jean moments. And then we think of something like language. If you are able to understand that you have providers that are bilingual and they're serving a patient population has language barriers, for example, you can now go from leveraging just HCP provider level centric clinical data, targeting oncologists serving breast cancer patients, to targeting innovative bilingual oncologists serving breast cancer patients with a language barrier. So think about the opportunity and how that can really impact engagement through greater personalization, but then ultimately improving patient outcomes, which is what this is all about.
Now, as someone who's worked across healthcare and data strategy, how do you define effective HCP engagement in today's landscape?
Yeah, I would say that, the brands that are really elevating their HCP engagement know that they have to have a core foundation of the data input, helping them to target providers. So they need to know, they have to have clinical intelligence to know that they're talking to the right HCPs, but then behavioral intelligence to know how to talk to those HCPs. The third piece here that I think is so crucial, and I love to see where this is coming into play more and more, is where the patient population and understanding more about what's impacting those patients that those providers are treating outside of the clinical setting. So we know 80% or more maybe these days of what impacts health outcomes isn't happening in the four walls of a clinical setting. So the teams that are leveraging those other, say, SDOH and social drivers of health factors about the patient population, or language barrier, for example, transportation access, and then they know that they can talk to the HCPs specifically about the types of patients they have, but also the type of people that they are treating. And I think that that's really where the opportunity for continued effective engagement sits.
If you could give one piece of advice to pharma marketers looking to future-proof their HCP strategy, what would it be?
Oh, I would say, continue to prioritize personalization over promotion, stay data-driven and behavior-led, and ask yourself, where's the opportunity for our brand and our team to be the bridge between the exam room and real life? So how can you serve as a partner for the healthcare providers and the patients that they're treating with communication that's not just going to be clinically relevant to highlight clinical expertise and experiences, but also build trust and empathy and continuity, go beyond the data with messaging that's going to resonate with the real people on both sides of the diagnosis.
Now, looking toward the future, tell me what's one bold prediction you'd make about the future of pharma marketing?
Well, I saw a phrase or a term somewhere that really stuck with me. And so I would say that, with continued ethical and transparent and more intelligent use of data, the future of pharma marketing has the potential to be invisible marketing. So rather than happening around, it would be an integrated part of the clinical care team.
Very good. Well, thank you so much for joining me today. I really appreciate it.
It's a pleasure. Thank you.